Welcome, and thank you for joining us for the Board of Certifications webinar titled Orthopedics, the First Athletic Trainer Specialty Certification. I'm Stacey Arrington, Compliance Manager for the Board of Certification. I will be moderating today's webinar. Please feel free to submit questions via the Q&A feature. We will answer as many questions as possible at the end of today's presentation. This webinar is being recorded and will be posted on the AT Specialty section of the BOC website. Our presenter today is Dr. Michael Hudson. Dr. Hudson is a certified and licensed athletic trainer. Currently, Dr. Hudson is an associate professor with the Department of Sports Medicine and Athletic Training at Missouri State University. His role includes teaching, research, and service for the department's professional and post-professional athletic training programs. In addition, he has practiced in outpatient clinic, high school, university, and professional sports settings. Dr. Hudson is the chair of the Specialty Council for the Board of Certification, as well as the chair of the CATI's Ethics and Professional Standards Committee. Previously, Dr. Hudson served as the District 5 representative on the NATA Executive Committee for Education. In this role, he chaired the Internship Work Group and the Board of Athletic Training Specialty Work Group. Dr. Hudson was awarded the 2018 Mid-America Athletic Trainers Association Athletic Training Educator of the Year and was recognized in 2019 as a Most Distinguished Athletic Trainer by the National Athletic Trainers Association. Welcome, Dr. Hudson.
Just quickly, disclosure, conflict of interest. As already noted, I am chair of the Board of Certification Specialty Council. Outside that, I have no known conflicts of interest with this topic. For this presentation, we got 4 objectives I'm going to go through. First one is terminology. Want to make sure we are all on the same page. Second, we'll discuss potential value of specialty certifications, specifically the Orthopedic Specialty Certification. Third, I want to go over the process for identifying and validating a specialty certification. Then fourth, I'll talk about earning the Orthopedic Specialty Certification. So first, let's get into some terminology. Certification, and we will use this term a lot, and we want to make sure that we are all on the same page with what we are talking about. So as you see on the slide here, certification is referring to a voluntary process where the individual, or in our case, practitioner, has entry-level knowledge and skills are demonstrated and measured against a defined standard. And we're going to come back to some of those parts when we start talking about specialty certification. So of course, we're all familiar with certification with our ATC credential. We completed our professional education through a CATI accredited program. Then after completing that, we took the Board of Certification examination, and when we passed that exam, we earned the ATC credential. So there are 2 parts in there. There's the professional education, which is administered by CATI. The part we are discussing, the part we're examining more, is the passing of the certification exam and earning the ATC credential. Now, specialty certification, as we put this in the context of athletic training and for athletic trainers, we are also talking about the entire practice of athletic training, but instead of a certification for the entire practice, we are instead looking at the certification of a specific area of advanced or expanded clinical knowledge and experiences, and then the formal recognition of the athletic trainer who has acquired that advanced or expanded clinical knowledge, experience, and skills. So let's get into some more specific characteristics of specialty certification. So first, it is a voluntary process, just like we are familiar with the Board of Certification ATC credential we earned. There is also an examination of that of the advanced knowledge and skills that we were just talking about in that very specialized or specific area of practice. There is going to be that demonstration and measurement of the knowledge, skills, and experience against defined predetermined standards, as I mentioned before. The education process is going to be will be different than what we're familiar with the ATC credential, because at this point we're talking about post-professional education, training through a residency, on the job learning, professional development, those experiences. But it's that measurement of that advanced, that expanded knowledge and skills in that specific area that the specialty certification exam will test. The purpose of the specialty certification is that recognition, formal recognition of the knowledge, skills, and experiences, with the purpose of building or enhancing the quality of care for our patients and advancing those clinical outcomes and optimizing those clinical outcomes. So the certification recognizes the individual who has that advanced training, who can provide that enhanced quality of care and improved clinical outcomes. The individual who has earned the specialty certification will also earn an additional credential. Not our ATC credential, something that goes in addition to that. And along with that additional credential will be maintenance requirements to maintain that credential however long that they choose to maintain it. Now these two terms here, assessment-based certificate program and professional certification, these are terms that are used in the credentialing industry that we want to make sure we understand well to be able to understand the concept of certification and specialty certification. So first, an assessment-based certificate program. It's a non-degree granting program, and an aspect or a key aspect here to look at is the program is teaching, provides instruction and training for the individual, the participant, who's attempting to learn specific knowledge, skills, and competencies. That program, in addition, also evaluates the participants' achievement of those outcomes. And then after that evaluation, we'll be awarding a certificate. And possibly, all depends on the program, may apply, or that individual may also earn credentials that goes along with it. When we look at professional certification, we also, or this concept of this term, this program within the credentialing industry, there is a credential that is awarded by the certification program, organization that does the certification. And that credential is a recognition of the individual possessing specific or certain types of knowledge, skills, and competencies. And once they have passed the examination, the assessment, to earn those credentials, there is a time limit on those credentials. So the individual is going to have to maintain the credential, the competence, by doing professional education, continuing education, additional experiences, and so on. So in a nutshell, the key differences that we want to look at between an assessment-based certificate program and professional certification. The assessment-based certificate program, the education and training, and the assessment is all administered by the same organization. Then if there is a credential that is earned after completing that program, that credential may or may not have an expiration date. And the ability to maintain those credentials, there may or may not be a requirement for continuing education. So it is up to that program to decide, do you have these credentials for life, or do you need to be doing other things to maintain them? But it's all contained within that program. So probably examples would be familiar to athletic trainers, athletic trainers is kinesiotaping, maybe Graston. You look at CPR certification. All those are administered by, the teaching education is administered by one organization as well as the assessment, and it can lead to credentials. Our credentials, we may have some continuing education to maintain it or may be able to maintain it for life. Again, that is an assessment-based certificate program. Professional certification, on the other hand, the education and training and the assessment, they are administered by two independent and separate organizations. The purpose of doing that is to improve or to show an unbiased evaluation of the knowledge, skills, and competencies that that individual has when earning the certification. So the education training is done by one organization. The assessment is independent of that and evaluates whether that individual has demonstrated successful completion of earning or of having those knowledge and skills. The second key issue there is to understand that the credential that will come with that professional certification will require continued education and a maintenance of that credential. It is not given for life. There will be a requirement to continually learn and expand and advance the knowledge and skills. So coming back to what we're familiar with, great example there is our ATC credential. Remember, we went through our education and training through a CATIE accredited professional education program to learn the practice of athletic training. But the assessment after going through the education is all administered by the Board of Certification. So we have that independent testing of the education and training. And then once we have that ATC credential, we must do the continued education and training, our professional development, our continuing education, to maintain the ATC credential. Now, taking all that, we get to the focus of our webinar here, the orthopedic specialty. Well, we want to make sure we understand the difference between two things, orthopedic specialty and orthopedic specialty certification. So first, what is the orthopedic specialty? Well, this is the training that athletic trainers, the education, experience, and training that athletic trainers receive in advanced areas or that expanded area of musculoskeletal conditions or orthopedic conditions with the purpose of improving health and welfare of the public who are suffering those conditions. What makes up the knowledge and skills of that specialty? Well, it's started by the practitioners. They're the ones that build it, but the evaluation, the assessment, comes from what's called a practice analysis. We're going to talk a little bit about the orthopedic practice analysis that was conducted by the Board of Certification to identify those knowledge and skills that make up the orthopedic specialty. Now, once we have that practice analysis to define the knowledge and skills, then an evaluation, a test, can be created to examine those knowledge and skills. And the individual who passes that test will then have that formal recognition of somebody who does possess the knowledge, the advanced or expanded knowledge, skills, and experiences, and in this situation, specifically in orthopedics. So we got the orthopedic specialty, which is the practice that advanced knowledge, skills, and experiences in orthopedics. And then we have the orthopedic specialty certification, which is separate from the education and training and is that evaluation of the individual's ability to have acquired the knowledge and skills and then formally recognizing that individual as having those knowledge, skills, and experiences. So now let's look at some potential value with the orthopedic specialty certification. And just to frame this again, so we're all on the same page, a quick review of the athletic training strategic priorities. As we've already said, we all went through our professional education, which taught us the knowledge and skills and gave us the experiences for athletic training and to practice athletic training. after we finished that education and training, we were able to sit for the Board of Certification examination. When we passed that examination, we then earned the ATC credentials, and then we could start our career as a practicing athletic trainer. As we start to develop that career, we learn more and we gain more experiences. And then we can start to specialize in an area of athletic training and expand that knowledge, those skills and experiences, and start to build expertise. And this is where the specialty certification comes in. Now, the education and training for the specialty is separate than the certification. So any individual can go down the path of gaining that specialized knowledge and skills. The purpose of the specialty certification is to come in and again acknowledge through an accepted process, an accepted standard in the credentialing industry, to say that this individual does have the knowledge and skills when they say they are a specialist in a certain area. And in the situation we're talking about orthopedics. Now, after that individual can then take their knowledge and skills and experiences and relay that, educate, instruct other new clinical leaders to keep advancing that area of practice. And it can be for athletic training overall, or it can be within that specialized area. And then we get to the point of the stewards of the profession, where they are maintaining the knowledge and skills and experiences, as well as creating new knowledge and expanding the skills. So what evidence do we have in athletic training to support this path of developing specialties and specialty certifications? Well, of course, as right now, we do not have board certified athletic trainer specialists, because we need to have the specialists be created first. They have to have the education and knowledge and pull that together and organize it before there can be an evaluation of that. So we don't have the board certified specialists. However, we do have the residency trained athletic trainer specialists. So these are the individuals that have been learning the knowledge and skills and gaining the experiences in that specialized area. And there has been research conducted of those residency trained athletic trained specialists. And from that, one part first is that literature that we're seeing has primarily been in the area of orthopedics. So that's what we're drawing from. But within that body of knowledge, we do see patients and physicians who are satisfied with the athletic trainer residents, feel they're doing a very good job. The perceptions of their healthcare knowledge and skills, as well as the monetary value they bring in, is also very good. There is a need for more specific patient outcomes, but in many different healthcare professions, there's always a need for that. That is a difficult thing to generate, and generating that evidence. So we need that, but we are similar to other healthcare professions where many others need that as well. Now, noting other healthcare professions that have had the education and training as well as the specialty certifications, we can infer some of the value of specialty certification from their research and their evidence. So first, nursing, we'll look at there. And they also are continually building it, but there is more knowledge that we can draw from. What we see from their literature and their evidence is the nurse with specialty certifications. There is some evidence of improved patient outcomes. The nurse specialists also feel greater empowerment from their certification, as well as they feel that it enhances their skills. The physician, we also see evidence in their literature in regards to patients in hospitals valuing the specialty certification. The physicians feel the self-assessments are of value and help them develop and grow. They believe that the specialties help with interprofessional practice, The specialty certifications correlate well with education experience, exam performance, fewer malpractice issues. Again, there's a need for more patient-reported outcomes, but overall, we do see the value in medicine with specialty certifications. So the process, how is a specialty identified and how is a specialty certification created? Well, this is where the Board of Certification Specialty Council comes in part. The actual identification, the actual creation of the specialty, that's not what the Specialty Council does. The actual creation of the specialty comes from the practitioners. And in their practice settings and the demands that come from the patients and the healthcare environments they're in, of what these practitioners can do, that is what forms the specialty. That is what creates a specialty. The Board of Certification Specialty Council, its purpose is to recognize that and to validate that so that we can give that recognition to the athletic trainers as well as establish the credentialing process. Now, here are the members of the Board of Certification Specialty Council. Part just to identify here is that we have wide or diverse representation from the profession. There's non-voting members from Katie, we have BOC staff members, and we have voting members that come from practitioners in different parts, NATA and so on. At this point, these individuals have been appointed and selected for the Specialty Council because of their knowledge and expertise with education and certification and specialties and policies and procedures, writing, creating. So they've bought all that in to help build and grow this. But within that process, or within the creation of the Specialty Council, there's also the procedures in place that as we have more board certified specialists, that those will be the individuals that will come into the Specialty Council and then oversee the guidance or guiding and recognition and validation of specialties and new specialties and maintaining specialties we already have. So that recognition and that validation, where does it come from? Well, within the credentialing industry, it comes from a process called the practice analysis. And again, we should all be familiar with that because the practice analysis is used to examine athletic training, and that is used to create the certification exam that we take to earn the ATC credential. So that practice analysis validates the domain's knowledge and skills for that discipline, and once that is validated, now there is the outline, the structure to be able to create the certification exam. So with orthopedic specialty certification, we have the orthopedic practice analysis. It's been validated. There is some refinement that's going on with that because this profession is continually evolving and changing. So some of that work is being finished up. But from that practice analysis of the orthopedic specialty, we are able to create a certification exam that then tests or assess the knowledge, skills, and competencies for the orthopedic specialty. The process of the practice analysis, basically it's two phases. First phase is to bring in the diverse panel of athletic trainers and others, such as physicians, who specialize in orthopedics. So the individuals who are recognized as practicing this specialty, the specialized area of practice. And then through guided and detailed discussions from individuals who are experts in the practice analysis process, guides that panel of athletic trainers and others for identifying those domains, tasks, knowledge, and skills. And once that is identified, it's used to create a survey that then goes out for the second phase, which would be the validation phase from a larger random sample of athletic trainers, is specifically here looking at the orthopedic specialty, of athletic trainers who are practicing that, and in the future would be athletic trainers who have the specialty certification, and it examines those athletic trainers' evaluation of the performance expectations, the importance, and the frequency of the domain's knowledge and tasks and skills that were identified by the phase 1 part of the practice analysis. And as I already mentioned, we do have that validated orthopedic specialty practice analysis, but it is also going through some refinement to bring it up to date because of the growth of the specialty area. So the last part, earning the orthopedic specialty certification. Well, in a nutshell, there's going to be 2 routes towards earning it. And these routes, what we're talking about here is the education and training to acquire the knowledge, skills, and experiences for practicing that specialty, that specialized area of practice. One route will, of course, be Acadia accredited residencies in orthopedics, as we talked about the orthopedic specialty. The other route will be other education and experience that the athletic trainer is doing on the job, professional development, other practice setting experiences you're going through that are specifically immersed in that orthopedic specialty. Now, we have a lot of details organized, but they're not finalized just yet. So we are fine-tuning that, finishing that, and as noted here in this slide, we will be releasing that for public comment in the fall. So I don't have it to show the specifics right now, but in general, what it's going to identify is this is the education and experiences that you need to be eligible to sit for the orthopedic specialty certification exam. Now, the other part, as we're talking about a certification, is that it will earn a credential, and that credential must be maintained. And it has a shelf life and won't be able to have it indefinitely. So every so often, we have to report the continuing education experiences that we have acquired to maintain that credential. The plan, again, a lot of it is done. We have specifics. We still need to finish some fine-tuning for that. But the idea is one plan will exist no matter which route you went through to become eligible to sit for the certification exam. There will be one plan to maintain that credential. And again, that one plan, when we have the specifics finalized, will come out for this public comment. So that leads into this slide here, our tentative timeline for the work that we are doing. Fall 2020 will be the public comment period for the eligibility and the certification maintenance requirements. As well at that time, the finalized orthopedic practice analysis will be published on the BOC website, so everyone can see the domains, knowledge, and skills and tasks that are part of the orthopedic specialty or that make up the orthopedic specialty. In the spring of 2021, the final eligibility and certification recertification requirements will be published, and then specifics for preparing for the exam will also be published. And then by summer of 2021, we'll begin accepting applications for the first specialty certification exam, the orthopedic specialty certification exam, and then begin to administer that test. So that concludes this short presentation and gets us to our question and answer time. As you can see on this slide here, please submit your questions for the Q&A feature. You can email questions or submit your questions using the Q&A feature. Or you can email your questions to stacya@bocatc.org. Again, stacya@bocatc.org. And we will try to answer as many questions as we possibly can. Any responses that we are unable to get to during this time, they will be posted on the BOC website. And also note in the slide here, some may receive a survey requesting feedback on that refinement for the orthopedic practice analysis. So some of you look out for that. And again, thank you so much for attending our webinar and being here. And we will get into the question and answer period, and hopefully I can provide some more clarification, some more information for you. Thank you very much.
Thank you, Dr. Hudson. At this time, we will begin the question and answer session. First question, is this to replace or to make consistencies in the fellowship programs like Emory or the Stedman Clinic? If you have completed these programs in the past, will you be grandfathered in?
Thank you for that question. Thank you, Stacy, for helping moderate the presentation and everything that we're talking about here today. And this question is a very good question. I see two parts in it. So the first part where it mentions replacing or to make consistencies in the fellowships. There's a couple things in there. Terminology is one part of our presentation. So I see the term in there, fellowship. That is something that falls on the education and training side. And within this realm of specialties, fellowships technically go into the area of subspecialties. So your individual program, the ones you're referring to, may have that term fellowship, but I'm going to use more the term residency to address this question. But the residency part is the education and training. And the specialty certification is not here to replace that education and training. The education and training still has to occur. What the specialty certification will do is provide that formal recognition of somebody who's gone through the residency training, that education, and give that person that recognition to the highest level we can within the credentialing world to say, yes, you now demonstrate the knowledge and skills for that specialized area of practice that came from your education and training. So it doesn't replace it. It just recognizes, it gives that independent recognition of that education and training that you went through. So there's one slide in here where I mentioned we have residency trained athletic trainer specialists, but we don't have board certified specialists. So the residency trained specialist, that is still there. Somebody can go through that education and say, I was a residency trained specialist. If they want to go to the point of saying I'm board certified in that specialized area, that is what the specialty certification is for. So the second question of completing those programs and being grandfathered in, within the credentialing world and following the standards of the National Commission on Certifying Agencies, NCCA, if you go through the education and training, you don't get grandfathered in with the specialty certification because you did the education and training. However, there is a part where grandfathering is allowed to a certain degree, and that's the individuals who are the specialists, the ones that come in and do the test writing, because you can't have these people come in and write test questions and then have them take the test. So there is a grandfathering part for that process. But if you're not part of that, if you're not a test writer and performing that aspect of the credential, there won't be a grandfathering in. If you've gone through the education and training and you want to, because remember, it's a voluntary process, and if you want that board certification recognition, you'll have to take the test. I think that answers that one, Stacy.
Yes, thank you. We've gotten several questions asking how much do we think the test will cost?
Yeah, that's a very good question. That is one that I am not aware of because that is more of an internal question within the Board of Certification, and they have to examine everything that comes along with the creation of the test, administering the test, and so on. So we have not got into that part. Stacy, is there any information that you have to be able to share in that, or is that work still being done?
It is not available at this time. It will be posted on the BOC website on the AT specialty section at a later time when we do have that.
Okay, thank you.
We have a question. How do you foresee the certification helping to further our profession? Is this more about consistency of ATs working in orthopedic settings, getting better paying positions in this setting?
Okay, again, very good questions, and I see a few different ones in here, so I'll try to take them in as they're presented. So the first one, how do I foresee the certification helping further our profession? The recognition in healthcare, there was one of the slides in there, it was in nursing and medicine, and the recognition that patients and employers, the individuals who are operating, administering healthcare facilities, they value those healthcare practitioners that can come in and say that they are board certified in a specialized area. As we are all well aware of, the knowledge and skills in healthcare, whatever discipline it is expanding, and it's expanding very quickly. And to have all that knowledge and skill to be able to come in and take care of the needs of the patients, there is a need for that specialized care. There is just more information, more knowledge and skills that's needed. So those healthcare facilities value that. They're looking for those individuals. So the athletic trainer who can come in and say, I'm an athletic trainer, and that is being recognized as a very valuable healthcare provider. With that athletic trainer saying, also being able to say, I'm board certified in a specialized area, that improves that recognition. Now, it all depends on that organization, and of course, what they value. But again, as the evidence that we are seeing is the patients and the healthcare provider, or the healthcare providers and the healthcare administrators, they value those healthcare providers to have that certification. So right now, based on that evidence, it appears that it will help further recognize and show the value of the athletic trainer. The consistencies, or more consistency of athletic trainers work in orthopedic setting. The practice analysis will definitely help with that, because it will start to bring the athletic trainers who are practicing that specialty together. But it's also in the area of the residencies. Residencies will be overseen by Katie, and they will be bringing in the residency educators who are also the practitioners. And as those individuals come together more and more, and they start to share the knowledge and skills that they have, we should start to see more of that consistency. It's just that natural growth that will occur in the profession. Now, as for paying positions, that all comes back to the state you're practicing in, and the organization that you're practicing, where you're employed. Practice acts, we know, vary from state to state, and some practice acts are a little bit more open, less restrictive, some a little bit more restrictive. So when we look at the practice of athletic training, you first have to look at your practice act for athletic training, because this is not a new practice. This is still athletic training. So the practice act you have in your state is still identifying that. It is just expanding in a certain area of your practice as an athletic trainer. So as long as your practice act is allowing, in your individual state is allowing for that athletic trainer to be able to perform and demonstrate those skills, the next part is where you're employed, and then how that employment setting and how your employers want to use the athletic trainer. And if that athletic trainer brings in knowledge and skills, that is something that that employer is able to compensate or receive compensation for, that should generate greater pay. As we said, there is some evidence that we are seeing about the improvement, the monetary value of these athletic trainers who are residency trained, being able to improve the monetary value of that practice setting. So the initial evidence we have right now shows that it can go in that direction. But again, we're at the very start, so we can't say for certain what's going to happen, but it is going in that direction. I think we're good there.
Our next question, would this specialty be good for someone who works in a college setting, or those who only work in the orthopedic offices?
That's a very, very good question. All these are very good questions. This specialty is not intended for a specific setting. The specialty is athletic training with one area of athletic training that is advanced, or I said expanded, the specialized area. So if the setting you're in a college setting, if the knowledge and skills that are in that specialized area, if that employment setting and the patients that you are working with need that knowledge and skills that you can bring in, then yes, it can definitely fit within that setting. It all depends on the demands of the patient and the place that you're at, what they need, and then does the knowledge and skills that you have, that you've acquired through your education and training and now being board certified to show that recognition, if it can be applied, if your patients can receive that value, then yes, it can definitely fit in there. There will be parts of the practice analysis that you will see that will definitely lend itself more to the clinic or the hospital setting, because again, remember, the practitioners are the ones that bring together the specialty and the specialty practice. So that's where those athletic trainers have been practicing. But that doesn't mean that's the only place. It can exist in any setting where the athletic trainer is.
Have the specific competencies for the exam been established?
The specific competencies for the exam. So the practice analysis has been completed, and the practice analysis identifies the domains and the task statements, knowledge and skills that are in there, and that's what starts to create the exam. There's some refinement that's occurring in there. As we said, that we're working on that finalization, and then in the fall, that practice analysis will come out. And then when you see that practice analysis, you will see the domains that are there, and then the knowledge and the skills and such. There is, if we look back at athletic training and we talk about the 5th edition of the athletic training competencies and such, that doesn't exist. But that would be more on the education side. And as this grows, you may see that, but again, that's on the education side. However, on the credentialing side and the board certification side, we do have that outline of the knowledge and skills.
What if we hold another credential, such as OTC, ROT, OPEC, or if we have worked in physician practice but moved on to another setting?
So those other, again, wonderful question. Those other credentials, there has been you should have acquired certain knowledge and skills because of those credentials. I believe all those credentials that you're referring to fall under that concept that we mentioned in the presentation about assessment-based certificate programs versus professional certification. I gave you the two general takeaways. Remember, the assessment-based, the education and the assessment is all kept within house, and you can earn a credential, and the credential may be indefinitely. And where the professional certification, they separate the process, and the credential, you definitely have, you have to maintain it. But there's also aspects about that get deeper. You know, how much is actually being taught and educated in those different ones. This is a very, very general statement, but when you look at, say, the practice analysis for the orthopedic specialty, you'll see that the knowledge and skills is much broader. It's going to cover a lot more content than what you would see in an assessment-based certificate. So the ones that you're talking about, there would be some of that education and training. And the fine-tuning that we are doing on the eligibility criteria, the eligibility criteria to sit for the test, those are things that we are still, again, trying to finalize and figure out. But it would, if you don't go through the residency route and you've gone through the other education and training, there will be the submission of the education that you have acquired and the experiences that you have acquired. And some of that information could be in there. And I stress could be because, again, we don't have it finalized. But I would say that if you have those certificates, that you might have some of that documentation to start showing you have done some of that education and training. But remember, you're going to have to show that you have the education and training for the entire specialty. and those certificates will more than likely not cover the entire specialty.
Will those who completed non-accredited residency programs be permitted to take the test for certification?
Again,
And
very good question. Oh, go ahead, Stacey. I didn't hear the last part.
Follow up with that one. What about those who complete a residency program that is seeking accreditation?
Very good. The non-accredited ones, when you have completed that, no, that one will not be allowed through the CATI accredited route. Now, remember, we have developed 2 routes, and we still have to fine tune that. So you could have gone through a non-accredited residency, but everything that was in your residency is all the things that you need to demonstrate through the other route. We have an option B, or the education experience route. But when we have those specifics there, you could go back and look at everything that you did in the non-accredited residency. And if you see that you have all those things in there through that residency, you would just be applying through the option B, the alternate, the other education experience. And so you would still be eligible for that. You just have to look back and see what it was all involved in that residency. The reason that it has to be accredited is because with that CATI accreditation, there has already been that external oversight to say all of this stuff was already done in the academic or the residency program you went through. So it won't keep you from doing it. You wouldn't go through the CATI accredited route. You will be going through the other route. And you just have to pull that documentation together to show that you've had the education and training. For the programs that are seeking CATI accreditation, again, that's some of the finalized questions that we need to figure out. But if it doesn't have that accreditation, it may not fit the CATI accredited route, but again, it could fit within that alternate route.
How long must someone who has been working in the orthopedic practice setting have been working to be considered eligible to take the exam? That is, someone who has not been through a residency but has been working with an orthopedic surgeon for years.
Yes. So if you've been working with an orthopedic surgeon for years, and when we get those specifics about the experience, how many, not years, would be more maybe along the lines of how many hours and how many cases and where have you been immersed in that. And if you can document that and show all that stuff, then you may very well have, you may very well have all the evidence to show that you are eligible through that alternate route. One question with that is, if this occurred years ago and it hasn't been recent that you've been doing this, that may not count towards that, because as we mentioned in the presentation, there is the growth and the development and the advancement of the specialty is occurring very quickly. So if this was many years ago and you haven't been immersed in that setting recently, then you may not have the education and experience at this time. That doesn't mean you can't acquire it. That doesn't mean you can't still do it. It just might mean that you've got to get back into some things. But if you are currently doing it and you can demonstrate the education and experience that is needed, then yes, if you're practicing in that setting, it could work. I know I'm saying a lot of could here because we really got to have those finalized specifics that we're close to having. They just aren't done yet.
Are casting, bracing, traction, and wound care a part of the CERT exam?
Those things are in the practice analysis. I couldn't rattle off everything specifically in there, but I'm pretty sure everything that you had said is in the practice analysis. So if it's in the practice analysis, that means that it is a potential test question. And then with the eligibility part, you wouldn't necessarily be showing every single thing in the practice analysis that you've done, but you would be showing that you've been immersed in experiences and you've been participating in professional development that would address those things in there.
How will this new specialty be different from the OTC? Is this new certification projected to benefit the profession more than the OTC?
Well, in the general sense, yes, it is anticipated to benefit the profession more, because if we go back to those two concepts, an assessment-based certificate program and professional certification, those other credentials generally fall under that line of an assessment-based certificate program, and they do not fall in line with the professional certification. And so what we are working on is professional certification. So in a nutshell, what we're developing is the ability for somebody to say, I am board certified in this specialized area. There is, you can say I specialize in an area, and you may have education and training to be able to say that. The part we're trying to get to is to that added phrase of board certified. And that concept, that term of saying board certified, carries more weight within the healthcare world, because it's recognized that you have had this specialized education and training, and then you have been independently assessed on that knowledge and skills to show that you have acquired it at a higher level.
Doesn't our education to become an athletic trainer already make us orthopedic specialists? How does this differ exactly?
That's a very good question. And remember, as we said, when we talk about a specialty, we are still talking about the practice of athletic training. So athletic training is orthopedics. There is a lot of parts of athletic training that orthopedics. But if you look back at your professional education, there is only so much of that. And there is more to learn. There are more skills to develop. So the specialty is, the special education and training is to take that part and expand it and give you more experiences, give you more knowledge, so that you are an athletic trainer, and your athletic training practice covers the domains, clinical diagnosis, emergent care, those things that are in the practice analysis for athletic training. But then the specialty takes a part of that and expands it and grows it even more. We know there's always more to learn. There's always more that we can, more skills that we can develop. And that's what the specialty is trying to do, or that's what the specialty is doing, is organizing that. And then the specialty certification is giving that external validation and recognition that the individual has it.
Okay, I think we have time for one more question. Is this certification offered for all AT settings? That is, will the process for the certification be functional for the high school athletic trainer to obtain the certification?
Well, we had a question like that a little bit before. It is not setting specific. Now, when you look at the knowledge and skills in those domains, yes, there will be parts of it that really fit within one setting more than another. But that doesn't mean that any athletic trainer out there can't pursue it. Again, what you want to look at pursuing is, who are the patients that you're caring for and what setting that you are in. And if the patients and the setting you are in would receive value from the education and training that you have, and then that board certification, and if it was in the secondary school setting where you're at, then that may very well fit your situation. There is the interest and the work that is starting to have other specialties. So for example, another specialty that we would like to see, hopefully the practitioners start to come together and share the knowledge and skills that is expanding in a certain area, would be in pediatrics. So if you are in the secondary school setting and you feel that you have learned more and you practice more and you do more than what you learned from professional education, and that knowledge and skills that you've learned is specific for the patient population you're working with, such as in the secondary school or primary school settings, and that you may be creating a new specialty, and that new specialty may be pediatrics. And that might be the specialty that fits better in your setting. To get to that part, there are steps. We talked about the practice analysis. To get to the practice analysis, there's a petition process. Then I think there's some information on the BOC webpage about that. We didn't get into it in this presentation because we want to focus on orthopedics. But if there is, when that orthopedic practice analysis is out there and you look through that and you say, some of this fits my patient population, but not everything, okay, what may be occurring in your setting is a different specialty that is creating. And then that's those practitioners coming together, starting to work together, starting to share their knowledge, starting to build it to the point of saying, we believe that this specialty exists for these patients that we are taking care of. And if so, then a petition is submitted to the specialty council. If the petition, everything that's in there looks correct and looks appropriate, that there might be this new specialty, then it would advance to the practice analysis process to recognize and formally validate it. And if that formal validation comes back saying, yes, it exists, then it goes down the path and then we have a new specialty.
All right. Thank you very much, Dr. Hudson. Our
You're
allotted
very
time
welcome.
Our allotted time for this webinar is about up. We will be adding responses to questions that we were unable to address today on the AT Specialty section of the BOC website. Early next week, you may receive a survey requesting feedback on the orthopedic practice analysis. The survey will be sent to a stratified random sample of current ATs, so not everyone on this webinar will receive it. We greatly appreciate your participation today. Have a great day.